My name is Jim Giangrasso. I'm a 55-year-old. I had a meniscectomy. I've been running for about 10 or 12 years recreationally. I've also been cycling. I've always had knee pain, and I've sort of ignored it and dealt with it in other ways. This year, when I started to train for triathlon season for this summer, I just knew I wasn't going to be able to get through the training. It just had become too painful. So it was sort of a gradual build-up over probably a decade. So I had Googled best knee doctor in New York City. After looking at probably about 5 different doctors, I thought Dr. Noy just looked very impressive. He seemed to have a very impressive list of clientele, a lot of professional athletes. And even though I'm a recreational athlete, I knew that he would be able to handle me. Right off the bat, I knew I was in the right place. They were extremely welcoming, made me feel at home. It didn't make me feel like I needed to be a professional athlete to be there, even though I knew Dr. Noy had a great reputation. Originally I went in for just a cleanup of the meniscus, and when Dr. Noy was in there, he saw a few other things he wanted to take care of, and he just did it on the fly. As luck would have it, I actually won the lottery for the New York City Marathon this November. I had told Dr. Noy going into the surgery that here's my goal. I'd love to have knee surgery and run a marathon in the same year. I thought he was going to laugh at me, but he actually shrugged it off and said, well, I'm glad you told me that. And I think that's totally doable. But it was actually quite relaxed. I had the surgery at his surgical center, which is incredibly clean, right off the bat. Cleaner than any hospital, I think. There's a nursing staff that takes care of you all the way up to the surgery and does all the pre-surgery work. Surgery was on a Friday. He said by Tuesday you're going to wonder why I asked you to stay home all week, and he was right. So I think by Tuesday or Wednesday I felt pretty good. It was nice to not have had to take any painkillers. The second weekend after the surgery, I was up and around and went to the mall with my wife and felt pretty good walking. A lot of times in medical care, you don't get a good feeling in terms of client service these days, but that's totally the opposite with Dr. Noy's office. I think that's the thing that really would lead me to recommend him to anyone. I'm planning on doing a 20-week marathon training, and if I do it, I'm going to definitely send Dr. Noy a picture of me crossing the finish line.